Hello, Mr. Buchanan. How are you today?
I'm good, how are you?
Awesome. I'm Ashton Lambert. I'll be your student occupational therapist today.
All right.
The doctor has ordered me to come in and do an OT evaluation on you. I understand that about a week ago you were having surgery for coronary artery bypass graft, and during that, unfortunately, we had a right CVA, and so that's given us a little left upper extremity hemiparesis. Sorry about that. So we're going to evaluate some things and see how it affects you functionally and how we can improve all of that and make it better. Does that sound okay?
Yes.
Awesome, great. So before we get started, just out of curiosity, do you know where you are today?
Yes, I do. I'm at the University of St. Augustine. I was in the hospital and I'm doing
Great.
okay now.
Awesome. And can you tell me your name?
Yes, I'm Bradley Buchanan. I was born on January 19th, 1986.
Good deal, good deal.
Mhm.
All right. I see you live at home with your wife and your daughter, and she's about 2. Is that correct?
Yes, it is.
Anybody else in the home that lives with you?
No, just our dog, besides my wife and daughter.
All right. Awesome. Can you look at that clock right there on the wall for me and tell me what time it is and what time it'll be in an hour?
Yes, I think it's a little hard to see, but I think it says 11:30 a.m. and an hour it'll be 12:30 p.m.
Great. Awesome. Good deal. Okay. So tell me what your living situation is like at home as far as where it's at and what level it's on.
Well, I live in St. Augustine. It's a 2-level house with a couple stairs at the front, and then it's got about 5 or 10 stairs to get to the second level as well. But it's got a rail that I can use on the right side to help myself get up and down.
Okay. And is your bedroom on the first floor?
It is. Yes.
Okay.
Yeah.
Good. Good. Alrighty. Were you independent with everything, with driving and cooking and cleaning and all that before you got here?
I was, yes. My wife usually does the cooking and some of the cleaning, but I try to help out as much as I can.
Cool. Can you tell me what a typical day is like for you?
Yes, the typical day would be I get up. I usually have to get my daughter up. She usually gets up at the same time as I do, and I get her dressed, change her diaper and all that, and feed her, and then I get dressed and I take a shower, then I get dressed. Make sure I get that right. I don't want to take a shower with my clothes on.
Yeah.
So I usually just after that I get my stuff together and go to school and do the school thing, and then come home and have dinner and just do the normal family thing. So
Cool. That looks good. What is your prior medical history consist of? Is there anything besides the hypertension and the arthritis that you have going on?
not really, no. No,
Okay.
not really, no.
And I see here that we have our precautions are some sternal precautions and some nectar thickness, and we also have a little bit of the orthostatic hypertension going on.
Mhm.
So we'll address all of those and be very mindful of those as we go through treatment.
Okay.
Are you aware of your sternal precautions?
I think I know a few of them. All I really know is that I can't lift more than a jug of milk, but I don't know much more than that.
Yep, it's about 5 pounds. We don't want to lift any more than about 5 pounds.
Okay.
So that would make picking up your daughter difficult right now, but we'll work on that. And then it's no pushing or pulling. So as a good rule of thumb, we kind of tell people to cross their arms when they go to stand up or to sit down, so you're not tempted to reach back or push or pull on something, okay?
Okay.
Great. So, what did you have for dinner last night?
Last night, well, today is Sunday and yesterday was Saturday. Last night I had some sushi from Fuji, Japan. I had a spicy tuna roll
Oh, wow.
and I think it was a Philly roll.
Okay.
Yeah, it was all right. I really like sushi.
Yeah, good. Me too. Did you do okay with eating that with your right hand?
Well, yeah, I use the chopsticks usually, but the sushi rolls were, they're big enough to where I can just pick it up with my fingers and eat it instead of having to do the traditional chopstick way.
Okay, good. And do you cook a lot at home?
My wife does. I don't really do a whole lot of cooking.
You don't do
I usually do the breakfast.
Okay.
I like to make BLTs.
Oh, nice.
Yeah.
Nice. Okay. Well, I know we've been having some shortness of breath here lately, so let me just ask you this. If you were cooking and, had some eggs or bacon going on the stove and you got the temperature on high and stuff and you got a little dizzy, what might you do with all that going on at the same time?
Well, I would try to sit down in a seat, and I would try to use some techniques of slowly breathing out and breathing in. So I would take deep breaths and just.
Okay, what about the food on the stove? Would you do anything with that?
I would, honestly, if I was short of breath, I would just leave the food and I would let it burn,
Okay.
and I would just throw it away as soon as it was done. I would make sure, that there wasn't a fire precaution or anything, but if I was short as, I don't want to pass out, so I would try to sit down as soon as I could.
Good thinking. Well, and if you have time, you could hit it to the off button, but
Right.
if not, your safety is much more important
Okay,
than
that's a good
than
idea.
that. So,
Yeah.
good. Awesome. So when did you get to St. Augustine? What did you come down here for?
Well, I came down for school about probably 8 or 9 months ago, so I've only been here for about 8 or 9 months. But before that, I lived in Tennessee for about 15 or 20 years. That's where I married my wife, and we had our child and everything up there. So yeah, we've been here for about a year now.
Okay. What city did you grow up in Tennessee?
I grew up in Kingsport, Tennessee, and then I moved to Knoxville after I got done with college in 2008 or 9.
Good. Well, I see your memory is very well intact, both long term and short term, very
They're
descriptive.
both pretty well functional right now.
Great. Awesome. All right. And you said you were independent with everything, but you didn't use any assistive devices around the house or?
Not really, no.
Good. Have you ever fallen around the house? Issues with falls?
Well, there's a lot of toys and stuff around my house. There's a lot of clutter, so I've tripped and stumbled a couple times, but it's never been to where I've hit my head or been a real safety issue. So.
All right, good to know. Tell me some things that you like to do for fun.
Well, I like to cook, but I only like to cook breakfast. So I try to make the faces and stuff out of the pancakes. It makes it fun for me. I build airplanes, and I like to play with my daughter a lot too.
Of course. Great. Well, those are fun things to do. Awesome. Do you wear glasses or have any trouble seeing that you're aware of?
Sometimes I have trouble seeing far away, but I can normally see things that are pretty close.
Okay, so like, for example, what's the doctor's name on the board over there?
I think that's a James. I think that says Dr. James.
Okay, yep, that's correct. And how about that sign over there on the edge of the room there?
That's a little harder to see. I can only really make out a couple of those words. It's really far away from me.
Okay.
All I can see is "do not." I don't really know what it says.
All right, good deal. Alrighty then. Just going to kind of test your vision a little bit more now that we kind of see there. So if you'll follow my finger, don't move your head, just your eyes. Awesome. All right. How many fingers am I holding up?
3.
Good. Great job. It's kind of bright in here. Does that bother you ever?
Sometimes I get some headaches, and the bright lights really stimulate that sometimes. But if I'm not in an area with bright lights for a very long time, it's not that big of a deal.
No big deal. Nothing's kind of changed so far since having the CPA.
No.
Good. All right. Well, let's do a few things to check for some strength and mobility. But before we get started with that, are you having any pain anywhere?
Besides the pain in my heart that I can't use my left arm right now, but it's not like a pain. It just hurts my feelings. You know?
Okay. And everything from the surgery is
Yeah,
fine?
the surgeries, it hurts a little bit, but now that I know my precautions, I'll make sure not to do any pushing up when I sit up or anything. So
Okay.
other than that, no, I don't really have any other pains.
Okay. And if you had to rate the pain in the chest here on a 1 to 10, what might you give it? 10 being the worst, 1 being knocked off.
Probably a 3.
Okay, good. So very minor. Good to know. All right. So let's see here. Can you take your arm and extend it out like that for me? Okay. And how about bend it? All right. And can you reach behind your back and give yourself a pat on the back there? Great job. Okay. And let's check this one here. Which one? Seems a little bit stiff. You're having a little bit of trouble with that there. Kind of tightening up.
It feels a little more stiff than it was, yeah.
Good deal. Good deal. Stop there. All right. Let's try and take this. Can you feel that?
I feel it on this side. I don't feel the tenderness so much, but I feel pressure.
Okay, cool. Can you close your eyes for me? All right. Can you tell me which side is in the air? Which arm might be in the
My
air
left
right now?
side.
Your left side. Good. So let's go ahead and can you do like this with your fingers on your right side? And then open and close. Any problems with that? Awesome. All right, and you're an electrician, so I'm sure you use your hands a lot, so
Yeah, I do.
we'll need to focus on getting that back soon. It shouldn't be too much of a problem there.
Okay.
All right, can you let me do like this for me? Any pain with that?
No.
All right, if you'll hold it right there, I'm just going to kind of push on you, and I want you to not let me move you, okay? Hold, don't let me move you. Great. Not feel all right?
Yeah, I feel fine.
Can you shrug your shoulder like that for me? Good deal. And I'm going to kind of help you move this one up. Bend the arm just a little bit, and then good. No pain, right?
No.
Just a little trouble.
No gain.
Good deal. We don't want too much pain here. So, okay, so you can do that. You can go out. How about, can you kind of go like this with your arm? There you go. How about with your wrist in general? Can you do that? Good deal. Let's try this one here. Here's some. All that feels okay. All right, so your hands, can you squeeze my fingers for me? Awesome. And anything right there? All right, we'll work on that, don't worry. So that looks good, you're doing great. I'm gonna get you working on that left side. Now, are you, you said you were driving beforehand. Do you understand that it's not safe for us to be driving right now? We don't want that to happen.
Yeah, I think my wife will have to drive me around until I can get this arm working again. Because I have a 5-speed, so I can't shift and steer at the same time.
Okay, good. Good to know. We'll be working on that, and hopefully she can help out in the meantime. So as far as goals, what kind of things would you like to work on with our therapy here? Things you want to focus on getting back to?
Well, I'd really like to get back to driving.
Mm-hmm.
That's something I really want to do. I'd really like to work on getting dressed, I guess, faster in the morning to be more efficient. And then I'd really like to be able to play with my daughter and pick her up.
Of course. Yes, absolutely. One more thing I forgot to check here. Can you do, just want you to go like that. for me? Good. Any pain?
Mhm.
So we see just a little bit of stiffness, but you still get a full range in there, so that's great. So your goals sound really good. Definitely understandable and obtainable goals. So I think we'll really focus on some things to increase your muscle endurance. You know, we can do some activities we can do while we're standing, so that'll help with getting us used to going up and down and maybe decrease some of that shortness of breath. And you know, we'll have to move up to it with all the heart conditions that you have going on right now, but that will eventually help lower the orthostatic hypertension. Won't get as dizzy from sit to stand, and then the muscle endurance will help with when you won't get as short of a breath while you're getting dressed and doing stuff like that.
Okay.
So all that would be some functional mobility things too. So we'll work on all that, and then some coordination skills. Since we're struggling a little bit with that left side, we'll try to get that back going. And with the dressing, I know you have a little bit of trouble with that since you can't use that left side. You got a bunch of t-shirts right now. Your wife bring you some t-shirts? Okay, good. So with the t-shirt, we'll kind of do, we'll take it around the collar, roll it up a little bit, and we'll stick your left affected arm in there. And then we're going to pull it up as far as we can, and then you can kind of grab the hole for the head of it and bring it and pull it up and around, and you can get that right side in there. So, and then pull the rest down. So dressing with that left side first, putting our arm through that will help with that affected side and make it a little bit easier for you. Does that sound okay? Good. So all of that will help, and it won't be too bad. It'll be, we're going to see you 30 minutes in the morning, so we can do some of the dressing and the bathing, stuff like that, work on endurance and coordination in the middle of all that as well, and then 30 minutes in the afternoon, so we can focus on some of the other stuff like cooking and doing things that'll help you get back to playing with your daughter, and using that hand dexterity so that we can get back to being an electrician and building the airplanes and all that.
Okay.
And we'll do that for the next week, and then probably by then you'll be ready for discharge. So in the meantime, we're really going to focus on using that left side to help us do some of our normal goals. So something I want you to do, which might be a little difficult at first, and you might not get a whole lot out of that left side, but thinking about it and telling your arm to do it and watching your right side do it will help make the connection for that, regain that connection for that left side to do it. So something we can kind of work on is like folding clothes. So then you're kind of focused on both the hand dexterity and regaining that muscle function in that side.
Mm-hmm.
So we can fold, like one of your t-shirts, we can fold this side with our right hand, and then use the left side a little bit to grasp it and pull it over on the left side of the t-shirt, and then you can fold at the bottom. So you can kind of use your right hand to make your left hand do the things you want it to do, and hopefully over time it'll get a little bit easier for it. You won't need as much assistance from the right hand, but just really being aware that we want to work on that left side is really important. And then another thing we can do is buttoning a shirt. You can kind of hold down the left side of the shirt and work on buttoning it with the right. Okay? And then, so when the nurse comes in, something that we can have her help you work on would be just getting you to make some kind of transfer, some kind of movement every time she comes in. Whether it be just one sit to stand, or whether you get up and go to the bathroom, or some kind of transfer. That'll help with our endurance and our shortness of breath and the hypertension and everything. I don't believe I saw you do any transferring. Can we work on that real quick? I'm going to just set this down for a second. And if you will, kind of cross your arms like this, and you can use this one here to lift it up. Great, awesome. And I want you to just lie down for me if you can, so with his feet up. Great. All right, feeling okay? Okay, so we're gonna do this slowly, but I'm gonna want you to sit back up, and I'll be right there next to you. All right, so if we'll bring those feet off, and we're gonna slowly come into a sitting position. Great, and so see how easy that was? Well, it wasn't necessarily very easy, but how we can do it without doing any pushing or pulling, right? Okay. Good. Now, I'm gonna have you stand up and transfer into this chair, but again, I want you to be real mindful of not pushing or pulling, so we'll just be an up, over type deal, okay? All right, now hold on just a second for me. Are you feeling okay? Not too dizzy?
Mm-hmm.
Okay, great. Come on over here. Great job. All right. Wonderful. We'll give you a second to regain your breath there. All right. Let's stand up. And something that you can do to help with standing as well, since you can't use your arms, is kind of scoot your bottom to the edge of the chair and lean forward when you stand up, okay? Make it a little easier for you. Awesome. No trouble with any of that. That looked really good. You seem very balanced and not too dizzy. So that's great. And where's your call bell at?
It's right here in the pocket.
Oh, great. Okay. So and you know what you can use the call bell for, right?
Yeah.
If an emergency happens.
I sure do.
Good deal. Good deal. All right. And the dressing we kind of addressed already. Feeding. Do you have any trouble feeding yourself right now?
I just use my right hand.
Use your right hand. Okay, good. Good deal. And then if you have trouble opening something, maybe until we get that left hand functioning, you can kind of use your mouth to grip and pull from the other side to open a packet of ketchup or something like that. Okay, great. And we saw you can roll as well, sit to stand, lie to sit, so that's all great there. So, like I said, we're going to really focus on that left side, and then I said we're going to have the nursing staff at least make some kind of movement with you, and all those will help with what we got going on. Does that all sound okay to you? Sound like it applies to your goals and everything?
It sure does, yeah.
Great, awesome. That'll help get you independent as quickly as possible, and I'm thinking we're going to do inpatient rehab for about a month after you leave here. It'll be good because the sterile precautions are something that we really have to make sure we follow so we don't rip that suture back open. And it's really hard to remember not to push and pull on things. We're just so used to it in our daily routine. So the inpatient will help with that, and then a lot of times we see the most recovery for stroke patients within the first month. So really want to have you in there and have some good treatment going on continuously to try and regain that left upper extremity function as soon as possible.
Okay.
All right. So I would also recommend that we get you to an eye doctor to have it checked out. Your near vision seems okay, but it seems like you're struggling a little bit with the distance. And,
Yeah, I do sometimes.
okay, we don't want that to affect your driving or anything like that. So that'll be good there. And as far as assistive devices go, I was thinking that we could get you a shower chair as a safety precaution right now,
Okay.
with the shortness of breath and stuff, or the hypertension. If you were in the shower and you got really dizzy, we wouldn't want you to pass out in there, so you'd have that. And with your shower having the raised tub, like you mentioned earlier, a shower chair would be good to help you cross your arms and kind of come back to the back of it, sit down, and swing in. And that way you wouldn't be trying to use the handrails or anything like that, because again, that would be pushing or pulling to get you into the shower safely. So shower chair is a little bit safer bed there. And then a button hook might be something good as well for you to use until we can get that back, because it's very hard to button with just one hand. So
Okay.
we'll try that. and then possibly even a raised toilet seat, just depending on how we're doing when we leave here in a week. If you're still very dizzy and very unsure of your footing and stuff and
Okay.
lack of endurance, we want to be able to sit down safely. A raised toilet seat would help us do that. So
Those all sound like things I could use that would be helpful when my wife's not around.
great, awesome. Well, I really look forward to working with you. Thank you for your time, and we're going to get you back to functioning just the way you were beforehand, okay?
All right.
All right, thank you very much.
Thank
Have a
you.
good one.